Welcome to the lecture on the leg muscles. There are three compartments in the leg formed by the crural fascia, which is also known as the deep fascia. This also then forms the motor map. There are three compartments: the anterior compartment, lateral compartment, and posterior compartment. The anterior compartment's muscles are innervated by the deep fibular nerve. The lateral compartment's muscles are innervated by the superficial fibular nerve. The posterior compartment actually has two portions, a deep and a superficial compartment. These compartments' muscles are innervated by the tibial nerve. Pause the lecture to draw in the motor map of the leg, including the three compartments and the nerves that innervate the compartments. Also be sure to draw in the crural fascia. The muscles of the leg are as follows. In the anterior compartment, we have tibialis anterior, extensor hallucis longus, extensor digitorum longus, and fibularis tertius. In the lateral compartment, we have fibularis longus and fibularis brevis. In the posterior superficial compartment, we have gastrocnemius, soleus, and plantaris. In the posterior deep compartment, we have tibialis posterior, flexor hallucis longus, and flexor digitorum longus. The proximal attachment of tibialis anterior is the lateral condyle and shaft of the tibia. The distal attachment is the first cuneiform bone, as well as the base of the first metatarsal. The tibialis anterior performs ankle dorsiflexion and intertarsal joint inversion. The tibialis anterior is innervated by the deep fibular nerve. Pause the lecture to draw in the attachments and the muscle belly of tibialis anterior. How does your drawing compare? Extensor hallucis longus is attached proximally to the interosseous membrane and the fibula. Its distal attachment is the distal phalanx of digit 1. Extensor hallucis longus performs ankle dorsiflexion, some intertarsal inversion, metatarsal phalangeal joint extension of digit 1, and interphalangeal extension of digit 1. Extensor hallucis longus is innervated by the deep fibular nerve. Pause the lecture to draw in the attachments and the muscle belly of extensor hallucis longus. How does your drawing compare? The extensor digitorum longus can be thought of as analogous to the extensor digitorum in the upper extremity. The extensor digitorum longus forms the dorsal hoods or the dorsal expansion at the metatarsal phalangeal joints. The dorsal hood is an attachment site for the plantar and dorsal interossei of the lower extremity. The proximal attachment of extensor digitorum longus is the interosseous membrane, the lateral condyle of the tibia, and the shaft of the fibula. Its distal attachment is the middle and distal phalanges of digits 2 through 5. Extensor digitorum longus performs ankle dorsiflexion, intertarsal eversion, metatarsal phalangeal joint extension of digits 2 through 5, and extension of the proximal interphalangeal joints and distal interphalangeal joints of digits 2 through 5. Extensor digitorum longus is innervated by the deep fibular nerve. Pause the lecture to write in the attachment sites and draw in the muscle belly of extensor digitorum longus. How does your drawing compare? The last muscle in the anterior compartment of the leg is fibularis tertius. Fibularis tertius may be absent in some people. It may also be considered an extra tendon of the extensor digitorum longus. The proximal attachment of fibularis tertius is the distal shaft of the fibula. Its distal attachment is the base of metatarsal 5. Fibularis tertius performs ankle dorsiflexion and intertarsal eversion. Fibularis tertius is innervated by the deep fibular nerve. Pause the lecture to draw in the muscle attachment and muscle belly of fibularis tertius. How does your drawing compare? Now let's talk about the lateral compartment muscles of the leg. The first muscle is the fibularis longus. Fibularis longus is attached proximally to the proximal 2/3 of the fibula. It courses down the lateral aspect of the fibula around the posterior lateral malleolus and then dives on the plantar surface of the foot to course medially to attach distally to the first cuneiform, the base of metatarsal 1. Fibularis longus performs ankle plantar flexion and intertarsal eversion. Fibularis longus is innervated by the superficial fibular nerve. Pause the lecture to draw on the proximal attachment of fibularis longus to the proximal 2/3 of the fibula. Then draw the tendon of the muscle belly coursing around or posterior to the lateral malleolus. On the lateral aspect, the tendon will cross over the calcaneus and then under the cuboid to reach medially toward the first cuneiform and the base of the first metatarsal. How does your drawing compare? The second muscle in the lateral compartment is the fibularis brevis. Fibularis brevis lies deep to fibularis longus. Its proximal attachment is the distal 2/3 of the fibula. Its distal attachment is the tuberosity of the fifth metatarsal. Fibularis brevis performs ankle plantar flexion and intertarsal eversion. The innervation of fibularis brevis is the superficial fibular nerve. Pause the lecture to draw in the muscle attachment and muscle belly of fibularis brevis. How does your drawing compare? Note that the fibularis brevis muscle tendon courses posterior to the lateral malleolus, as does the fibularis longus. Now let's move on to the posterior superficial compartment. Gastrocnemius. Gastrocnemius is attached to the lateral and medial femoral condyles, as well as the tuberosity of the calcaneus via the Achilles tendon. The gastrocnemius performs knee flexion, ankle plantar flexion, and subtalar inversion. Gastrocnemius is innervated by the tibial nerve. Pause the lecture to draw in the muscle attachment and muscle belly of gastrocnemius. How does your drawing compare? Note the lateral and medial heads of the gastrocnemius muscle. The soleus muscle lies deep to the gastrocnemius, but is considered one of the posterior superficial muscles. The proximal attachment of soleus is the soleal line of the tibia and the posterior fibula. The distal attachment is the tuberosity of the calcaneus via the Achilles tendon. The soleus and the gastrocnemius make up what we know as our calf muscle. The soleus performs ankle plantar flexion and subtalar inversion. The innervation of the soleus is the tibial nerve. Pause the lecture to draw in the attachments and muscle belly of the soleus muscle. How does your drawing compare? Note that the muscle belly of the soleus courses further distally compared to the gastrocnemius. The last muscle in the posterior superficial compartment of the leg is the plantaris. Plantaris has an attachment proximally to the lateral epicondyle of the femur. Its distal attachment is the tuberosity of the calcaneus. Note the tendon of plantaris is not part of the Achilles tendon, but it does lie in close proximity and medial to the Achilles tendon. Plantaris performs knee flexion and ankle plantar flexion. Plantaris's innervation is the tibial nerve. Pause the lecture to draw in the attachments and the muscle belly of plantaris. How does your drawing compare? Now let's move on to the posterior deep compartment. There are three muscles in the posterior deep compartment, which we refer to as Tom, Dick, and Harry. Tom stands for tibialis posterior, Dick stands for flexor digitorum longus, and Harry stands for flexor hallucis longus. All three of these muscles extend tendons that course behind the medial malleolus. The proximal attachment of tibialis posterior is the interosseous membrane and the posterior tibia and fibula. The distal attachment of tibialis posterior is the plantar surfaces of the tarsal bones and base of metatarsals 2 through 4. Tibialis posterior performs ankle plantar flexion and intertarsal inversion. Tibialis posterior is innervated by the tibial nerve. Pause the lecture to draw in the attachments and the muscle belly of tibialis posterior with its tendon coursing posterior to the medial malleolus. How does your drawing compare? Flexor hallucis longus, which is referred to as Harry, is analogous to the flexor pollicis longus in the hand. Its proximal attachment is the posterior fibula, and its distal attachment is the distal phalanx of digit 1. Flexor hallucis longus performs ankle plantar flexion, intertarsal inversion, metatarsal phalangeal flexion of digit 1, and interphalangeal flexion of digit 1. Flexor hallucis longus's innervation is the tibial nerve. Pause the lecture to draw in the attachments and muscle belly of flexor hallucis longus. How does your drawing compare? Flexor digitorum longus is known as Dick. This muscle is analogous to the flexor digitorum profundus in the hand because its distal attachment goes to the distal phalanges of digits 2 through 5. Its proximal attachment is the posterior tibia. Flexor digitorum longus performs ankle plantar flexion, intertarsal inversion, metatarsal phalangeal joint flexion of digits 2 through 5, and proximal interphalangeal and distal interphalangeal joint flexion of digits 2 through 5. Flexor digitorum longus is innervated by the tibial nerve. Pause the lecture to draw in the attachments and muscle belly of flexor digitorum longus. How does your drawing compare? When looking at the muscles in the leg, the order in which they go from lateral to medial is Dick, Tom, Harry. As the tendons course around the medial malleolus, the order changes to Tom, Dick, and Harry. AN stands for and the nerve, which is the tibial nerve. So the tendon of Tom is in green, the tendon of Dick is in red, and the tendon of Harry is in pink. The yellow is the nerve, which is the tibial nerve.